Hi there, and thank you for joining UnSCRIPted. I'm Angela Kashuba, Dean of the UNC Eshelman School of Pharmacy. We have an amazing community here at the school, all working towards a shared goal of solving the world's most pressing healthcare challenges. And I'm excited for you to hear unscripted stories of faculty, staff, students, alums, and partners. Today I have invited Dr. Kamakshi Rao, who is Director of Pharmacy for Clinical and Academic Enterprises at UNC Health and Professor of Clinical Education at the UNC Eshelman School of Pharmacy, to my office today for a conversation. Thanks for joining me, Kamakshi.
Thanks for inviting me. It's great to be here.
So I want you to tell me about your educational and professional path. You have come to a very unique place where you are quite a bridge between the School of Pharmacy and the health system. And so I'd like people to hear about your career trajectory.
Yeah, and I think, starting in pharmacy school, there's no way I could have envisioned that this is where my career would lead me, but it's been such a rewarding journey. So over 18 years, there have been so many roles that have helped develop me. So I started as an acute care clinician, rounding on leukemia and oncology services. Really thought that that's what I would do for my entire career. Then recognized a gap for our patients in the ambulatory setting, so established ambulatory services in bone marrow transplant, and had a really rewarding 6 to 7 years as a clinical pharmacist practitioner in bone marrow transplant. The whole time, though, I've always loved teaching. And it's part of the reason that I came to UNC Hospitals was the opportunity to teach students from the school and participate in our residency program. So I became a program director for our residency programs, and that was sort of a gateway to leadership for me. Leading residency programs, eventually taking on a management role over our very large residency program at the hospital, and now being able to bridge my love of teaching with being able to mentor professionals. In a director role, I oversee now all of our clinical services for acute care, adult ambulatory care, as well as our learner experiences. So it's the full scope of when students first enter the health system to learn about institutional practice, to our clinicians who are really making a difference day to day in patient care.
Yeah. What is the most rewarding thing about your job currently?
I think on one hand, it's watching younger clinicians, including residents and then those brand new clinicians, really discover how they are meant to practice.
Yeah.
Our experiential students and residents, they go through rotations, and I feel like every rotation they take a patch of what that preceptor does.
Right.
Their white coat isn't really theirs when they start. And then they take pieces of other people's and they make this amalgamation of like their patchwork white coat that turns into the person they're supposed to practice like. I think the other part is, as someone who's been rewarded by a health system for putting in work, I've been supported by great mentors and leaders to develop myself. I think in my current role, the opportunity to offer that same mentorship, guidance, and watch people find those next steps has been uniquely rewarding, to watch people really thrive and grow and develop and find those next steps for themselves.
Yeah, I love that. As we talk about this theme of bridges, we have a very unique relationship that's called the Partnership of Patient Care between the School of Pharmacy and the health system. Can you talk about the Partnership of Patient Care from your experiences and what it is and what unique opportunities it has provided our faculty and our learners?
Yeah. At the hospital, I believe we have practitioners who are very, very committed to their craft. They pay so close attention to the things that are impacting their patients' well-being, their health, educating in an experiential setting. They have expertise there. At the school, we have faculty who have really strong research foundations, who can understand when a clinical question is asked, what's the methodology that can help us get an answer?
Yes.
The challenges that we tackle, though, are the same. We're both trying to advance healthcare. We're trying to make medicine better. my true belief is if we put these parts together, it's a 1 + 1 = 3 model. Because we're taking advantage of the unique strengths that exist at the hospital, the unique talents that exist at the school, and we're trying to create an environment where we encourage them to work together to solve each other's problems.
Yeah. No, I think that's terrific. I think the ability for us to work on research projects, to work in the educational enterprise, to work in the practice space together, we really complement each other. And I just love the way the partnership has been working.
Absolutely.
Yeah, good. You published an article recently on the importance of training a diverse healthcare workforce. Can you talk a little bit about that, unpack that for us?
Absolutely. To really serve our patients best, we have to meet them where they are. And that means understanding not just the diagnosis they have, but the life experience that they bring with them at that point of diagnosis. There is a lot of learning and reading one can do, but the best way to offer patients the best care is to have our teams reflect those experiences. Unfortunately, when you look at racial and ethnic distributions across the state, and then we compare that to the distributions of pharmacists, physicians, nurses, there's a disparity there that I think we have a responsibility to help shepherd a solution to. And part of that starts early, junior high, high school, talking to these students about the opportunities that exist in healthcare, explaining why having a representative practitioner population improves health outcomes. Simply, if you have a better, more representative, more diverse practice complement, your patients do better. I am only made better if I welcome a lot of other perspectives in to make sure those initiatives that we prioritize are the right ones. And I want to make sure I have those people at the table with me.
I love that. I think that's terrific. I want to switch gears a little bit. You are a certified professional coach.
I am.
So talk about how you got into coaching and what coaching means to you, and maybe what the most meaningful experiences you've had to date as a professional coach.
Yeah. Well, I actually have a lot of gratitude for you. It was actually early on in your dean's tenure. We had a conversation, and you asked me a question that surprisingly not too many people had asked me at that point. And you were like, what sort of impact do you want to have? And it forced me to think about how I wanted to use my voice as a leader to impact change in our organization. And you suggested that I look into whether a coach would be a good asset. And that experience of working with a coach was, to me, one of the most transformative experiences of my professional journey. Not because it taught me new ways of doing my work, but it taught me a new way of being myself.
Interesting.
I think a lot of times individuals walking into leadership roles or new professional roles, you look around, you see other people and how they're approaching their work. And you say, well, I guess that's what I have to do to be successful. And working with my coach helped me recognize how to pursue my own authentic path towards not trying to be someone else, not trying to lead in someone else's style, but finding what was uniquely driving. And so we talk a lot about mentorship in pharmacy, and mentorship is so important, but mentorship is steeped in a shared experience. Coaching allows you to step away from someone's experience and allow them to discover their own authentic journey that may look nothing like yours. I feel like it's a tool for better inclusion, and I have found that at times the simplest questions really unlock someone who's been stuck.
No, I love that. I love the fact that you talk about bringing your authentic self. And some people think of coaching as someone who's going to tell you the answers, but it's really that person bringing out your own answers.
Correct.
Yeah, which is an interesting way of doing it. And I just I appreciate the coaches that I have had in the past because this is a skill that I do not have, but it can be so powerful when you have a really good coach,
Yeah.
because the solutions that you bring forward yourselves are really those authentic solutions that
That's
are
right.
going to work.
That's right. But it is a very unique way of asking questions. It is not natural.
Right.
It is.
Yeah.
It doesn't just come to top of mind. You're crafting these questions in a way that opens and explores, and doesn't lead or guide. So it was an active journey to learn how to ask those questions.
Right.
How to be comfortable in silence when you ask someone a really thoughtful, provocative question, and then you make them sit with it for a very uncomfortable period of time.
Yes.
But when you do that and give them space to process, what usually comes out is so much more powerful.
Yeah, really valuable. That's amazing. Thank you for that. Can you tell me what advice you might have for UNC students who are looking to improve their leadership skills with all of the experience that you have? And I love the visual of the patchwork quilt white coat, because that is really true. So if we have, and we talk about at our school, we're developing leaders and innovators. So as a UNC pharmacy student, what advice do you have for them to develop leadership?
When I meet with students, it's not unusual for them to feel like there is a script that they must follow. There are boxes that must be checked in order for them to succeed. And I guess I would challenge back to say the number of check boxes that I think students think exist and the ones that actually exist are very different.
Yeah.
Yes, there are certain things that you should do. You should pursue breadth in your training. I would encourage students to not feel like they have to pigeonhole themselves too early. Explore things you never thought of, because your entire schooling is an opportunity for exploration.
Yeah.
It is not there to craft and cut your path. It's there to allow you to explore.
Yeah.
Stay curious. Stay present. Don't get bored easily. And all the way until graduation day, keep exploring. I'm someone that found my passion halfway through my last year of pharmacy school, and it crafted a 20-year career.
Yeah. And it really gets back to be your authentic self.
Absolutely.
The authenticity piece.
Yeah.
I love that. Tell me what you do for self-care.
Let's see. Well, I am a mom to a 6 and 8-year-old, so they occupy a lot of my dedicated self-care time. But I would say, for me, self-care is about habits that I know protect me.
Okay.
So I am a morning exercise person. So
terrific.
I set an alarm for 5:30 in the morning. I can be found on a piece of exercise equipment on the 3rd floor of my house.
Okay.
But my secret is that some days I wake up at 5:30, take a blanket, and go upstairs and lay on the floor for 30 minutes and then spray some water on my face before I come down to make it look like I worked out. But sometimes it's just really important to carve out that time that is just for me.
Yeah.
You know, that time in the morning is time where nobody's allowed to need me.
Yeah.
And that's really precious to me. It allows me to pour into others throughout the day. I also really believe in setting meaningful boundaries. And they don't have to be difficult boundaries to meet. I have a rule that says that I don't miss dinner with my family more than 3 times a month. If I have to miss a 4th, we have to have a real strong negotiation about it. It forces me to think about where I'm placing priority.
Yeah.
So setting those thoughtful boundaries and then really intentionally revisiting them every single year to make sure that they're adequate is important.
Wow, that's really good advice. I've learned so much from you today. Terrific advice. This has been such a fun conversation. Thanks so much for joining me today.
I really appreciate the time. Thanks for having me.
Absolutely. And thank you all for watching. We love sharing stories of those who make the UNC Eshelman School of Pharmacy excellent. We hope you'll join us for the next episode of UnSCRIPted, conversations with the people who are advancing medicine for life.